The following program contains mature subject matter. Viewer discretion is advised.
So, Dr. Danoff, let's say you are in this situation. What is your advice to your male patients as to how to maybe bring things back down?
Well, I mean,
think about that bowel movement, not what else you were thinking about.
Yeah.
I mean, Dr. Danoff, I guess it's normal to have up to 11 erections per day for men.
that is true.
Well, I guess I'm done for the day then.
TMI, baby.
I met my quota.
Many of those are not. Many of those are what we call nocturnal erections. So we have many erections during our sleep that we're unaware of. But you could actually monitor that. But it's very common, from little babies to older men. We use that test to sometimes separate psychological impotence from physical impotence, called nocturnal penile tumescence. All the psychological factors are gone, and if a man gets an erection during the night, we know that the arteries, veins, nerves, endocrine function, everything is intact. So it's a phenomenon and a very interesting diagnostic.
So, Dr. Danoff, I mean, that's a good barometer of your health, right?
That's exactly right. So if a man comes in with ED...
in some ways, I think what you're saying also is if you happen to have an erection while you're having a bowel movement,
that's one of your 11 of the day.
Yeah, and I think he's saying it's normal, but it's just not typical.
Well, also, men have talked about the men G-spot, the male G-spot, right? Drew, you've had it massaged numerous times on the show before.
To do with stimulation
while you were singing Barry White. You remember. But I would say the one thing, if this happened every single time you were having a bowel movement, it would be troublesome. This would be one of those things. So if that were the case, would it be a matter of, I'm just going to ask the question, if this were an issue for you and you were having difficulty making your erection go away, do you at that point self-pleasure? Do you like what do you do if that's the scenario? Because I'm telling you right now, that would not be a good thing. If every single time you have a number 2 movement, if you had an erection, that would be...
Yeah, but I think it's going to be a short-lived, self-limiting thing. I think it's related to the and then it goes.
Well, I think that if it happens every single time, and we say this time and time again on the show, is just please see a urologist, see a doctor, have it checked out.
In 11 years now, that's one of the more bizarre out there questions that we've received. But I think if someone's worried about it and you truly don't have an answer, go talk to your urologist, Dr. Danoff. We always appreciate your input.
It's a pleasure.